Assalamu alaikum, everyone. Thank you so much for joining today. I'm really excited to be back again with this. This is now the second health series, women's health series that we're doing. I'm Dr. Fatima Kapasi, and I'm hoping that we can continue seeing you throughout the rest of the series. We've sent out the link already, or uh, the proposed plan for the talks that we're going to have. The dates may change a little bit, but the talks are set, and we'll be talking through. So the focus of this health series is going to be um, how to kind of look after our general health. So there's a lot on diet, as we'll talk about today. There's going to be talks on obesity, on mental health, on cancer prevention, and everything in between. So I'm hoping it's really useful in terms of promoting long-term health and preventing illness. So I hope you find it useful. Today's talk is going to be by Nama bin Yusuf Ali. She is a registered dietitian and a certified diabetes educator. She's been working in Canada. She has over nearly 20 years of experience, so she comes with a breadth of knowledge and a wealth of knowledge that we'll get to tap into today, inshallah. She has been working in promoting both chronic as well as in clinical practice at the moment as a dietitian in a long-term care setting. I'll let her talk to you more a bit about her current work, but she's also very active in our community. She's done quite a few talks on promoting health and wellness. So without further ado, I will pass it on to Nama Ben. Thank you for joining us today.
Thank you so much, Fatima Bain, for the introduction. And thank you, everyone, for joining. I know it's hard Monday evenings, but thank you so much. And yeah, just to add, I work in primary healthcare clinics right now. I worked in Richmond Hill for last 16 years, and I moved to Mississauga. So I am right now, I have a couple of jobs, and then I work with type 2 diabetic patients with a pharmaceutical company as well. So we can get started. And, my aim is actually, I just wanted to keep this talk very general and informal as well. So feel free to write in the chat box, ask questions. Okay. So the topic is diet in the prevention of chronic diseases and weight management. And the focus is women, of course. Okay. So, uh, so today what we'll cover is the chronic diseases and what are the reasons, relationship of excess weight with chronic diseases, and importance of weight management, reasons for weight gain, and reasons for not losing weight, and then most importantly, the strategies to manage weight. Okay, so what are the different approaches? We will discuss that in a little detail. Okay, so I'm just going to first of all do a poll, sorry. So do a poll. Okay.
Navin, I can't see your slides. I don't know if you're sharing them yet.
Yeah, I'm sharing them, no? Okay, see if it shows you are sharing. Can you see it now?
Okay, yeah.
Yeah, okay. Can you see the polls? Can everybody see the polls?
Can't see the question on the poll.
You don't?
No.
Okay, I see them, so I'll relaunch and see. Can anybody see it now?
Yeah.
Okay. So which chronic disease do you most associate with excess weight in women? Okay, so 15 seconds. And Okay, so we'll 2 more seconds and I'll end. Okay, so most people said all of the above or type 2 diabetes. Okay, so basically the question, just to provoke the thought that the chronic diseases are really prevalent and especially in women, and lots of health studies have shown that women are at high risk, all the adults, but especially women, a higher incident of type 2 diabetes after a certain age, hypertension, cardiovascular, obesity related cancers. And, of course, it increases the risk of unhealthy aging and being more dependent. Okay, so why are we focusing on women? Is, after, as I said, certain age, before the age of 50, men have a higher risk of heart disease and hypertension, that's blood pressure. But as woman ages, perimenopause or menopause age, our estrogen level drops and the risk actually increases sharply. So often it surpasses the risk in men, okay, after the age of 50. And similarly, osteoporosis, thyroid disorders, 1 in 3 women over age of 50 will experience those as compared to 1 in 5 men. Okay, so there are other conditions too, as I mentioned, cancer, but we don't have time to go in detail. But why is weight management now important? As we age, weight management, and as you see, I'm not using the word weight loss, but weight management is more important because what happens that women after 35, we gain maybe 1 kg per year. We don't realize. But if we don't manage that, it's 1 kg per year. And in 10 years, it will be 10 kilograms, which is 22 pounds, right? So then there is a problem. So we focus on managing. So now, why we do the management is because if we control the weight, we can improve the cholesterol levels, our blood pressure, our insulin sensitivity improves, and of course the risk of heart diseases. We can monitor or prevent the risk of heart diseases, hypertension, and can also delay and prevent diabetes. We all are at very high risk, so the goal should be to prevent it or at least delay it. And then if we lose weight in a healthy way, then we can actually reduce the risk of osteoporosis. Okay, so now some of the reasons are, of course, excess caloric intake. So we have lots of the race, social life reasons and everything, right? I find I'm always invited to the race and shadi and all. Then, of course, hormonal changes, so there are some of the things that we don't have control on, our hormone changes. And because of that, our, leptin is an hormone that decreases. So we reduce that feeling of fullness. Metabolism slows down. Loss in muscle mass, mood swings, cravings, stress eating, all those conditions are associated with aging in women. And there are some medications, especially antidepressant and PCOS, some medical conditions as well. Okay, so now today we will actually try to focus on what we can do. Okay, we can't do anything with our aging or hormones or anything, but we have to learn to manage that. So what is in our control, we'll focus on that. Okay. Okay, so, have you ever, has anybody ever felt that they always eat healthy, but they are still not able to lose weight? So I get this a lot, lots of my clients, I get that, they're eating very healthy, but, after certain age, no matter what they do, they can't lose weight. Okay. So the reasons, of course, there are some of the things that we discuss are there, but the main thing that I find, in my clients is mindless eating. So there are so many examples. For example, eating directly from a container, especially, working from home, food is available, not able to portion, because we are eating from the package. Then, not focused on eating, focused on something else, and that, of course, increases the caloric intake. Then again, you know, we are working, but, uh, we are, again, not focused, whatever is at home comes out of the bag, in the mouth, in the stomach. And the availability of food. So if the food is available, we end up not throwing, but eating. So like, in North America, we produce food for like 10,000 times more than what we need. So for one person, there is 10,000 times more production of food in North America. So imagine, whatever we are bringing, we don't need it. It's lying and we are eating it. Okay. Now, sometimes, while cooking, so when we are cooking for our kids or husbands or anything, just to make sure it's good, we just end up tasting the food that's just extra calories that we don't need. And bulk buying, there is a discount available, so might as well, let me get 2 packets instead of one. I just need one, but I'll buy 2. The other reason is sugar, excessive sugar. Okay, so especially in the drinking form, and there are lots of evidence-based data available that says that, sugar, drinking form of sugar is very harmful. So, I mean, anything, healthiest food like smoothie, or unhealthiest like pops, juices, because when you drink sugar, you don't feel the satiety. You don't feel that you are full. And sometimes it actually increases the cravings. Sugar increases the craving for food. Okay. So again, drinking or excess sugar, most of the sugary food, the processed sugary food, are also packed with fat. So the cookies, cake rusk, chocolates, so there sugar is there, but it's full of fats. And if we see in nature, I don't think there is a single food that is um, fat and sugar together. So I think in nature, God has not, Allah મિયાએ કોઈ એવું નથી બનાવ્યું જેમાં sugar and fat સાથે હોય. Okay, fruits છે તો એ sugar છે, fat છે તો એ oil છે. I don't think there is an example. If you have an example, you can share. High in sugar, high in fat. So it's like all man-made things that's making our health, ruining our health. Okay. Now, okay, so like my focus is a lot on juices and drinking. And I find in my clients, when I tell them, lots of clients just stop drinking healthy juice, healthy smoothie, healthy, their weight improves, their cholesterol, triglyceride improves, their sugar, if they're diabetic, their blood sugar improves, their pre-diabetes turns into normoglycemia, their blood sugar comes to normal. Okay, so there is some common, like Tropicana, Minute Maid, the common juices. So can anybody guess how many teaspoons of sugar are in these ones? So you can type on the chat. Any guesses? Eight to nine. Okay. So very close, right? But better than. So usually, yeah, 6 teaspoons, 6 to 8 actually is normally in a cup of these juices. And this one, can anybody guess 1 cup, like 1 small cup of mithi lassi, how many teaspoons of sugar does it have? Very close, yeah. So 4 is the minimum. So usually if it's nicely mittu, then it can be 5. Okay, it's just unnecessary. We don't need it. And I've been advocating, everybody needs to advocate. Even in the Jamaat, we don't need to put sugar in the lassi. So it's too much. And I've seen people drinking 2 cups, 3 cups because people like it. So it's just unnecessary things that we are doing. Now, coffee. So just a French vanilla, how many teaspoons? No guesses? Okay, so 12 teaspoons in the, sorry, ice cap, and French vanilla, 10, medium French vanilla. Okay, so you can search it, look at the nutritional facts, ask for the coffee nutritional facts, just 10 teaspoons right away. And I see especially the newcomers to Canada, they just love it. And then in 2 years, they gain lots of weight. Okay. Sugar in tea. I get this question a lot of times. Chai ma sugar pivai, can we? So it's really, I don't have a right or wrong answer. It depends on how many cups of tea do you drink, right? So in a day, if you're drinking 2 cups, 3 cups, it's just unnecessary sugar. But if you can manage it, burn it out, or, reduce the sugar, that would be great. And, a friend of mine, she actually hates picky chai. So what she told me, oh, I'm drinking picky chai based on your advice, but she needs a chocolate chip cookie every time she drinks a cup of tea, So you need to just see what is better, a chocolate chip cookie or maybe half teaspoon of sugar in tea. Okay, so I
હેલો
just want to,
સલિકાબેન કેમ
sorry,
છો?
I
હા
want you
હા
to
બસ
listen to, oh my God, listen to this discussion which I have with my client. And it's a very typical, I get these type of clients all the time. 50% of my clients are like this. So just listen to.
હેલો સલિકાબેન કેમ છો? આજે તમારું મારા સાથે અપોઇન્ટમેન્ટ છે, તમને યાદ છે?
હા હા બસ તમારા ઓફિસમાં એન્ટર જ થઈ રહીશ.
આવો આવો. કેમ છો સલિકાબેન?
શુક્ર છે. તમને મારી હેલ્પ કરવી જ પડશે.
હા હા, તમે મને કીધું તું તમને વેટ મેનેજ કરવો છે, વેટ થોડો કમ કરવો છે ને?
હા બેન, જો ના મેં પૂરો દિન કંઈ નથી જમતી, બટ વેટ છે કે વધતો જ જાય છે. લાસ્ટ ફ્યુ યર્સથી મારો વેટ આઉટ ઓફ કંટ્રોલ છે.
ઓ નો સલિકાબેન, ચલો શ્યોર આઈ વિલ હેલ્પ યુ, ઓકે? મગર એના પહેલાં મને થોડી ઇન્ફોર્મેશન જોશે, થોડા ક્વેશ્ચન્સ કરીશ. ઇઝ ધેટ ઓકે?
હા હા, જે પૂછવું એ પૂછો.
સલિકાબેન, તમે મને કીધું કે તમે કાંઈ નથી જમતા, રાઈટ?
હા રિયલી, સવારના નાસ્તો બી નથી કરતી. સચ્ચી આઈ એમ અમેઝડ. લોકો કેટલું જમે છે મગર પતલા ના પતલા છે. બસ જો ના મારી કાઠી જ આવી છે. પાણી બી પી લઉં તો 5 કિલો વધી જાય છે.
સહી છે, ચલો કોઈ ફિકરની વાત નથી સલિકાબેન. મેં તમારા રૂટીનના બારામાં થોડું પૂછીશ, ઓકે? તો તમે મને એમ બતાવો કે કાલે તમે શું જમાતા, ઓકે?
હા
તો
શ્યોર.
સવારથી તમે મને શરૂ કરીને બતાવો.
જી, મેં 6:30 વાગે ઉઠી, નમાઝ પઢી, જલ્દી જલ્દી તૈયાર થઈને વર્ક પર.
ઓકે, ને વર્ક પર જવા પહેલા નાસ્તો લીધો?
અરે નહીં, ઈ જ તો. નાસ્તા વગર આ હાલ છે તો નાસ્તા સાથે શું થશે?
અરે, ચાય કોફી કાંઈ તો લીધું હશે?
કાંઈ બી નહીં, બસ રસ્તામાં ટીમસી કોફી લીધી.
ઓકે ઓકે, કોણસી કોફી લીધી ટીમસી?
એક ડબલ ડબલ, મીડિયમ હતી શાયદ.
ઓકે, ને એના સાથે બીજું કાંઈ નહીં?
ના ના, નથિંગ એટ ઓલ. બસ ગાડીમાં થોડા નટ્સ રાખેલા છે. હેલ્ધી છે ને, તો ડ્રાઈવ કરતા કરતા થોડું મોંમાં રાખી લઉં છું.
અચ્છા, ઓકે. એપ્રોક્સિમેટ કેટલા નટ્સ લીધા હશે?
બેન, હવે કભી કાઉન્ટ નથી કીધા. એક બેગ છે, 2-3 કપ મુશ્કેલથી નટ્સ, મિક્સ નટ્સ હશે. 3-4 દિવસ ચાલે છે.
ઓકે, ચલો બરાબર છે. તો આમ અડધા કપ જેટલા હશે?
હા, અડધા કપ હોય યા 3/4 બસ.
પછી ઓફિસ પહોંચીને કાંઈ જમા તમે?
કામમાં એટલી બિઝી હતી, ખાવાનો ટાઈમ કાં છે?
અરે, સો નો લંચ?
નથિંગ એટ ઓલ. કાલે બસ એક કોલીગનું બર્થડે હતું, સો ઓફિસવાળાએ પોટલક કીધું હતું. બટ મેં તો હાર્ડલી કંઈ જમી.
કાંઈ તો લીધું હશે બેન?
હાર્ડલી એક મેકેડેમિયા કુકી, કોફી અને એક નાનો ટુકડો કેક. બસ એકાદ પીસ ચોકલેટ.
ઓકે. અને બીજું કાંઈ નહીં સલીકાબેન?
ના બેન, આમ તો મેં નથી લેતી, બટ કાલે ગરમી હતી તો એક નાનો કોકનો કેન લીધો પાર્ટીમાંથી.
ને પછી ઘરે કેટલા વાગે પહોંચ્યા?
4:30 વાગે તક ઘરે આવી તો એકદમ થકન હતી. ઓફકોર્સ હવે ના નાસ્તો કીધો ના લંચ. ભૂખ લાગી હતી, બટ મેં પછી બી સિર્ફ ચાય લીધી અને હાર્ડલી 2 થી 3 કેક રસ્ક.
ઓકે સલીકાબેન, તમારી ચાય તમે મીઠી લો છો?
નામાં બેન, હવે ઓફકોર્સ સવારથી ભૂખી હતી, સો આઈ નીડ સમ ગ્લુકોઝ ફોર માય બ્રેન ટુ વર્ક. ઘરના બી પછી કામ હોય છે.
બરાબર છે. સલીકાબેન, કઈ ફ્રૂટ્સ ને બીજું કઈ સ્નેક લીધું?
ના, સવારે શાકેરીએ સ્મૂધી બનાવી હતી ફ્રીજમાં, બચેલી હતી તો બસ જરા જેવી લીધી.
ઓકે, કેમ બનાવે છે શાકિરભાઈ સ્મૂધી?
એક બનાના, એપલ, મિલ્ક, ડેટ અને ખબર શું શું શાકેર જ બનાવે છે. મેં તો થોડી ચાખી જ લઉં છું.
ઓકે, ને પછી રાતના ડિનર લીધું તમે?
ઓફકોર્સ બેન, સવારથી કઈ નહોતી જમી તો ડિનર તો બરાબર બનતા હે ના.
હા હા, બિલકુલ બનતા હે બેન. ડિનરમાં શું જમા?
તો ડિનરમાં એક રોટી, એફએમબીની તરકારી હતી અને થોડા ચાવલ અને એક ગુલાબ જામુન. ફાતિયાનું આવું તો થોડી મીઠી લસ્સી બનાવી હતી ઘરમાં, સો એક ગ્લાસ પીધી.
ઓકે સલીકાબેન, હવે થેન્ક યુ સો મચ ફોર ધ ઇન્ફોર્મેશન. હવે છે ને, જો તમારી જે એજના હિસાબથી મારા કેલ્ક્યુલેશનમાં શું છે કે આપને તકરીબન 1200 to 1500 કેલરીઝ લેવી જોઈએ, તો આપનો વેટ મેન્ટેન બી રહેશે અને લૂઝ કરવો હોય તો લૂઝ થશે. તો હવે જે તમે મને આપવું હતું ને, મેં લીખી લીધું છે, તો આપણે જોઈએ કે ટોટલ કેટલી કેલરીઝ બને છે. ઓકે, પછી એના બાદ મેં આપની હેલ્પ કરીશ.
બેન, હવે તમે પોતે જો, મેં તો 800-900 કેલરી બી નથી લેતી. 1500 લઈશ તો શું થશે?
હા ચલો, સહી છે, કાંઈ નહીં. હવે આપણે એમ છે કે જરા જોઈને આનો ટોટલ કરીએ ને પછી આપણે વાત કરીએ. સો હેલો સલીકાબેન, કેમ છો?
સો આમાં હવે કેટલી કેલરીઝ હશે, એની ગેસીસ? સો આપને રફ ડાયરેક્ટ કેલ્ક્યુલેટ કીધું તો એટલી હતી, રાઈટ? તો હવે બેસિકલી આમાં શું છે કે લોટ્સ ઓફ માય ક્લાયન્ટ્સ એ લોકો એમ હોય છે બિકોઝ વાકઈ એ લોકો જમાતો નથી ને, તે ડેન્ટ ઈટ અ પ્રોપર મીલ. તો થાય છે એમ કે ધીસ ઇઝ વાય દે એન્ડ અપ eating excess calories is mindless eating. Okay? mindless eating એક તો નામથી ખબર પડી જાય. બીજું શું છે કે જ્યારે આપણે પ્રોપર નાસ્તો નથી કરતા, એ પ્રોપર જમન નથી જમતા, તો આર બ્રેન ઇઝ રિયલી ડિપ્રાઇવ્ડ, અને જ્યારે બ્રેન ડિપ્રાઇવ્ડ હોસ તો ફર્સ્ટ થિંગ વી ગો ફોર ઇઝ શુગરી થિંગ્સ. ઓકે, તો હવે તમે સલીકાબેનની ડાયટમાં જોશો તો everything almost is full loaded with sugar or fat because she is just eating mindlessly, and still thinking that I'm not eating. Okay, so now હવે આપણે એક પોલ કરીએ વાપસ, અને પોલમાં શું છે કે સોરી, બેન તમારા પાસે છે ક્વેશ્ચન, બીજા પોલ્સ?
હા, I'm sharing it now.
Let me see. Okay, I got it. Okay, poll 2. All right, so Amache, which of the following is the most effective way to achieve weight loss? Intermittent fasting, keto or high protein diet, plant-based diet, detox drinks, or you can try every new diet trend on social media. Okay, 2 seconds more. Okay. Okay, so most people said intermittent fasting, okay? So basically, આમાં હવે એમ છે કે evidence એમ કહી છે કે there is no really effective long-term approach, not even intermittent fasting. Okay, so let's discuss all of these things briefly. Okay, so first of all, apne jo hai, intermittent fasting ma there are mixed evidence. એમાં એમ છે કે yeah, it does cause you to lose weight, but sustain નથી થતી. Most people cannot sustain it. Okay, sometimes it just slows your metabolism as well. Okay, so once you just stop intermittent fasting, then you gain all the weight back. પછી બીજું શું છે કે some people they miss on a major nutrient, you know, maybe એક food group completely omit કરી દેશ ને પછી deficiencies. Okay, so if you want to do it properly, then you should talk to your healthcare professional and do it. But again, you know, we basically as a diet, તમે કોઈ બી dietitian ને પૂછશો તો just sustainable જે way છે, it's not any of them. Okay, not even intermittent fasting. Now, high protein and keto diets. તો આમાં હવે શું problem છે high protein diets? Okay, I've seen people doing high protein diet. I've seen people losing weight very, you know, initially they lose great amount of weight. You know, I've seen people losing 10 kilos in 2 months, but I've not even seen even one person throughout my career who has maintained after losing. Okay, so ek to aaj again the same thing, long term it's not effective. The other thing is that, you know, high protein diet, especially meat, we end up eating high fat diet. So it can increase the risk of heart diseases. Okay, so again, you know, I mean, anything that's not sustainable is not good. You know, you lose weight, you gain weight, you lose weight. It's too much stress on your body. Now, the quick fixes by, like somebody I think said that detox drinks are good way of losing weight. So detox drinks and bija bhi ganal, you know, like recently there was this ginger shot very popular, and grapefruit drink, honey lemon, cinnamon honey lemon, એ તો ઘણું common છે. પછી બીજું શું, ઘણા બધા, like in on the web if you go there, they will give you all the magical recipes to lose weight in, you know, 30 days, 20 days. So there is, I just wanted to let you know, there is no evidence, no scientific evidence that these quick fixes will actually lead you to a long-term weight loss. Okay. So now what we do? Okay, so the consequences actually I already discussed, but basically what happens that, you know, anything on an extreme level you do, your body actually goes through too much stress. One of them is a starvation response. You're starving your body, you're missing some important nutrients. ને પછી શું થાય છે starvation response માં કે the metabolism slows down. So the weight, losing weight becomes harder and harder and harder. So initially you lose, pachi one, you know, you will plateau and then it becomes very, very hard. બીજું શું છે કે muscle loss, you know, it's very easy to lose muscles. Fat lose કરવું ઘણું hard છે. Okay, so you keep losing muscle initially and you think you've lost weight, but it's not healthy. The other thing is what is the, of course, you know, when you are starving or you're doing some extreme form of dieting, your body will crave, your mind will crave, and you go to binge eating, more craving, stress eating, all those factors. So what do you do now? Any comments? Okay. No comment. So, so basically, because we're talking about weight management, the main thing is anything you do, let's say you tried reducing your calories or any approach, the main thing is consistency. If you do it regularly every single day, then you will see results. Okay. ઘણી વાર શું હોય છે કે જે extreme dietમાં people do it for 2 months, 3 months, 4 months, 5 months, they give up. Okay. Then that weight gain that causes lots of stress, lots of disappointment. Okay. So small steps but consistent. કોઈ બી ચીઝમાં છે consistency છે તો આમાં બી છે. Okay. Other thing about consistency is the meal timings are very important. If they're haphazard, then again that causes the body to basically slow down its metabolism, or આખો જે બોડીનો મેટાબોલિઝમ છે એ ડિસ્ટર્બ થઈ જાય છે બેસિકલી. So by consistent meal time means that નાસ્તો છે within an hour કરી લો, જે બી તમારો ટાઈમ છે 6 to 7, 7 to 8. Not that sometimes you're eating at 6, sometimes you're not eating at all, sometimes you are fasting, sometimes you are eating heavy meals. That does not work. Okay. પછી સેકન્ડ, આ તો હવે this is અપનામાં છે જ, eat slowly. આપણે તો આમ બી થાલમાં સ્લો જમીએ છીએ, but people who eat fast at work, or always rushing, so busy, definitely leads to weight gain. And why? Because our brain does not know until 20 minutes that we are full. Okay. So within 20 minutes we've already eaten double than what we need. And you must have seen જ્યારે આપણે બાર કોઈ જગ્યા જમવા જાય છે તો જરા બી અગર સર્વિંગ લેટ છે તો you might have seen people saying that સર્વિંગ એટલી ખરાબ હતી, ભૂખ મરી ગઈ. Okay, so ભૂખ મરતી નથી actually. એ જે આપણે ખાઈ રહ્યા હોસી ઓવર ઇટિંગ હોસ, but now you got some time, so you're full. Okay, so we say that use 20-20 rule. So chew each bite 20 times and give 20 minutes to each meal if possible. The 20 minutes na api sakta hoy to at least just say how much time are you giving. Are you eating in 5 minutes? At least double it up. At least make it 10 minutes. Especially younger teenager girls, teenager boys need to slow down. Okay. Then portion control. Have portion control ma, it's not much time to go in detail, but basically our portion, just mindful eating ke kitlu khai letu. So this is just how do we control portion is just by the hand. Okay, so the palm of your hand, the thumb of your hand is like a fat. This handful is actually your carbohydrate, about this much is protein, and then vegetable, actually we say 2 fist. Okay, this is 1 but 2 fist, or even vegetables, green vegetables, you can eat even more. Okay, now who has heard about actually there is a poll I think for this. No, actually not. So anybody has heard about glycemic index? Any yes, any no's? Okay, so 1 person has. Okay, so most people have. Okay, so glycemic index, actually it is a ratio basically by which we measure that how fast a carbohydrate food turns into sugar when we eat it. Okay, and it's compared with white bread or sugar. So high glycemic index food means that they turn into sugar right away in 2 minutes. They turn 2 to 10 minutes actually, which high glycemic index, they turn into sugar. And low glycemic index food, they take much longer. Okay, so if anybody is interested, I'll be happy to share the full chart of glycemic index food. Most of the foods are included: fruits, vegetables, your starches. But generally, one very good way to manage weight is avoid high glycemic index food. Okay, and we already discussed a little bit: sugary drinks, juices, white bread. Drinks to khair, it's a special, definitely no when you're trying to lose weight. But white bread, rice dosa, Cheerios, instant oats, white rice, Chinese rice, not basmati rice. Basmati rice are actually good. White rice, naan, these are all high glycemic index food. And there are lots of foods. So if anybody wants, I'll be happy to share the list. Okay. Now, the other is the plate method, and I'm sure most people have heard about it, right? In the schools as well, your kids must be learning as well. So plate method, कि अपने अगर plate में जमता हो तो अपनो जो half portion of the plate छे इमा non-starchy vegetables, not the potato, sweet potato, ये नहीं आवे यहाँ, but leafy vegetables, broccoli, lettuce, anything you like, right? Then carbohydrate is your bread, roti, rice, oatmeal, quinoa, JB. The protein, of course, meat and dal and beans. So આવી तरह plate अपनी plate ने divide करवानु. Usually अपनु એમ હોય છે કે maybe rice या હોય છે, right? And then protein and vegetables, very little. Okay, so this is just a sample of breakfast, okay, which is healthy too and low in glycemic index. So for example, one slice of bread, multi-grain bread, ideal rye bread is good. Sourdough bread is really good with one egg. Okay. The other example could be a yogurt with fruit. Okay. Again, low glycemic index. And then the third one would be steel cut oats or rolled oats are also okay with fruits. Okay. And of course, a cup of tea. And it has about 300 to 400 calories. અને સલીકાબેનનું જે breakfast હતું એમાં કાંઈ બી નહોતું, right? Just a coffee and some nuts, and it was about this much, 762 calories. Okay, so we must eat breakfast. ને આ તો ખૈર હવે મોલા બી ફરમાવી ચૂકા છે બયાનમાં બી. Hamna suche, like right now, lots of fancy stuff, intermittent fasting and this and keto. And, like after few 5 years, 6 years, they say, no, this was not good, this was not good. But je cheez apne khabar che ke this breakfast eating has all like, it never denied it. There are strong evidence that eating breakfast helps to boost your metabolism. Okay. Now lunch. Lunch માં આમ જ મેં example આપેલી છે. Anything can be good, right? So maybe just a nice soup. Okay, cream of broccoli soup, cream of, like I make lots of soup. Cream of हमने squash sale पर હતા तो I make cream of squash soup and we take it for lunch. Small, serving of dal chawal. Not overcooked pasta, al dente pasta with maybe meat or anything. One sandwich. Okay, and then veggies. So veggies ma ઘણા મારા friends કહે છે કે they are, not a buffalo. That they, buffaloes are fed, they eat vegetables. But you have to eat it in the right way. Okay, so vegetables ma problem શું છે? सबसे main problem, what people face. Can anybody tell me what the challenges are in eating vegetables? Some people just can't get it every day. What are the challenges? If anybody can share, otherwise I'll share. Yeah, it's expensive. And the main thing is, the Munira Adib Benya Kidu ke preparation. When you come from work, you're so tired ke kon salad kape and kon, sometimes, people, my clients tell me they bring it, but they're too tired to cut it and, serve it. So what I suggest is when you do, like nobody does groceries every day, right? Like back home. So when you do your groceries once a week, just plan and bring maybe 2 or 3 vegetables. Bring something that's on sale, okay? So you will always find some vegetables cheaper, some less expensive, some more. So any 3 vegetables, choose different colors, and then chop it. I do that too, honestly, so because I don't have time in the week. So I just chop everything up on the weekend and I fill my container, big boxes. And then we have it every day. Okay, so if you just overcome that preparation part, it becomes very easy. Even if you're bringing frozen vegetables, let's say, you can grill it, grill your broccoli, grill your whatever, whatever vegetables you like, grill it, put it in a container, and then portion it. Okay, now portion control collectively. કે હવે આમાં શું છે કે આપણે હવે આ તો ઇન્ડિવિજ્યુઅલ હતું ઘરમાં આપણે શું કરવાનું છે કલેક્ટિવલી અગર આપણે હપ્તામાં 2 વાર 3 વાર રીઝન આવે તો આપણે શું કરીએ તો ઓફકોર્સ મોલા હેઝ મેડ ઇટ ઇઝી 1 મીઠાસ 1 ખારાસ નો વેસ્ટેજ સેકન્ડ સર્વિંગ્સ જેમ પહેલા થતી હતી બધું બી નથી થતું આમાં શું છે કે વી હેવ ટુ એડવોકેટ Okay, so FMB man, like I always give comments in FMB. Agar ekdam food creamy che, I put the comments. I know people don't like it, but we all have to do it, salty che, creamy che, portion keva che. You have to first of all advocate. Then while eating out, main thing is eating slowly. Jaman કરી રહ્યું છે, it's their responsibility to make sure we adhere to 1 mithas, 1 kharas, even if we are inviting people at home, even if it's not a formal daris, just inviting friends, why can't we do that? It's like just have one dish or don't make multiple dishes. It leads you to overeating. And I was just reading the stats, there is a full statistics about when jare be mithas, be kharas hati. So each person used to have about 1200 calories. જ્યારે કોઈ ઇઝનમાં જતા હતા એ લોકો about 11 to 1200 calories જમીને આવતા હતા, especially શતાબીમાં. અને હવે મોલાના ઓનાસી હવે it has come down to about 600. And we can still, cut it down, by maybe drinking less mithi lassi or less juice or, controlling the dessert portions. And the other thing is, અને આ તો જે છે ને family જે આપણે સાથે બેઠીને જમવું, it actually really helps with weight management. And in I think 2019 or 2020, dietitians of Canada નું જે main આખા વર્ષનું જે focus હતો એ આના પર હતું. We were actually advocating a lot કે જે families, they should start eating together. Nothing else but eat together, and that really helps. અને આ તો આપણા કલ્ચરમાં છે. હવે now the cravings that again, of course, women or ઘણા જે hormonal imbalances થી craving થાય છે. Yes, we do stress eat. How to manage that? So one easy way is hydration. Okay, so most of us, working women or busy ladies or busy even men, we are mildly dehydrated. Okay, થોડું જેવું dehydration છે, we are just functioning normally, but શું છે કે that dehydration often confuses us with hunger. તો આપણે છે dehydrated, લેकिન આપણે એમ લાગે છે કે આપણે ભૂખ લાગી, so then we go for, anything that's available. So best thing is, when you are hungry or craving, have a cup of water. And water, sip it throughout the day. Don't, indulge. So આ બી એક તરીકો છે કે sip it, keep a bottle, if you have a desk job, keep a bottle, drink it throughout, and just keep hydrated. And water-rich foods. Water-rich fruits, of course, એ હોય છે જે, vegetables or whole fruits. And today હવે બીજી ઘણી ચીજો હતી જેમાં આપણા weight management પર, but we take a rain check because fat intake is a big topic which I was not able to cover, and then salt intake. Okay, so maybe next time. But exercise, I'm not going to go in detail, but just read on the Health Canada website, ask your doctor, ask your dietitian કે શું કરવાનું છે, especially strength training ના બારામાં. We all should know, and especially women after 35, we all should be doing strength training. But so the takeaway message is that, make small changes. Okay, so weight basically, શું થાય છે કે આપણો focus ઘણો વધારે weight, and because of that we do extreme things. So take away your focus a little bit and focus more on health. So if you make little changes, improve your diet, increase more vegetables, just be consistent, that will lead you to weight loss, or at least manage weight. So gain thyreos in a thigh. Okay. And one step at a time. Okay. So any takeaways from today if anybody wants to share. So I'll just do a poll again, I think. Okay, not this one. Okay, so this is the third poll, if everybody can or whoever can answer. What's the most challenging part of maintaining a healthy weight? Portion control, craving or emotional eating, irregular timings, lack of time for meal preparation. Okay, thank you so much, everybody, for joining. Any questions?
Thank you so much. That was really, really useful. And I think, it's a really important topic, and we all struggle with it all of the time. So thank you for a lot of that insight. I think it would really help if we had that glycemic index sheet. I think a lot of people asked for it too.
I can send it to you, or I can share my
Sure.
email address
Sure.
on the
And
chat.
yeah, so and if anyone wants to put their email address on the chat, they can. Otherwise, yeah, we
Or
can see
just
if we can
email
send it
me,
through the.
whoever wants, and I'll share.
Okay, perfect.
Okay, so
That
that's my
works.
email address.
Yeah, I think the mindful eating one was really big because I think, as I said, we all do it not realizing that actually we're probably consuming more than we would in a sit down meal,
Mhm.
right? But yeah, if anyone has any questions, if you don't want to ask them out loud, feel free to put them in the chat and then we can take it from there.
So I think no questions, Fatima Bin.
Yeah, if you're happy to hang around for a little while, and then if people do have questions, they can ask as we go along. Is that okay with you?
Sure. Yeah. Which supplements?